tell me about
Sure.
platelet-rich plasma, because that's one that
Sure.
I don't believe anyone has specifically addressed on the podcast. So tell me
Oh,
about
wow.
what that is.
Okay, so well, PRP, platelet-rich plasma, is a process where we draw out your blood from a vein. We then spin it down in a special tube, and we separate out the platelets and the plasma from the red blood cells. So I use a process that separates out basically all of the red blood cells, and then we're left with the plasma, which is the yellow liquid portion of your blood, as well as the platelets. Okay. The plasma contains many different kinds of anti-inflammatory factors, and the platelets secrete a substance that's known as platelet-derived growth factor, PDGF. Okay, so we reconstitute the platelets back into the serum by like a nice gentle rotation of the tube. There's by the way, there's like dozens of systems out there for how people harvest your PRP. Everyone has their preference, and some will argue that this is so much better than that one. I have one that I've settled on, and it does the job for what I want it to do. I've had good results with it. And we draw the platelets and the plasma back out of the separation. And then we take that fluid, the platelets and the plasma, and we inject it wherever we want to have an effect. Okay. So it's particularly useful for joint and musculoskeletal problems. Okay. So shoulder pain, elbow pain, knee pain, back pain, neck pain, wherever it hurts, we can inject it. Is what it's actually doing is two things. Number one, the anti-inflammatory factors that are in the plasma are going to actually help calm down the inflammation in the local area. Number two, the platelets that are secreting that PDGF, that platelet-derived growth factor, are actually going to call in your body's own stem cells. Okay, so every person has stem cells in their body all the time. It's just how active are they? Okay. When we're little babies, like when we just came out of the womb, we got lots of stem cells, and they're really bouncy and they're super active, right? That's why people get stuff out of umbilical cords and placentas and whatever, or the own stem cells out of cord blood and stuff like that. So there's tons of them in there. The older we get, the lower the number of stem cells we have banging around is. Okay, but you can wake them up. Okay, and if you use things like platelet-derived growth factor, that wakes them up. Okay, you can do similar things actually with ozone injections. I don't know, did Dr. Schallenberger talk about doing ozone joint injections and stuff?
You may have touched on that.
Yeah, I know he loves to do that too.
Is that prolotherapy? Is
Prolotherapy, Prolozone, yeah. Exactly, Prolozone. So you can do Prolozone as well. Where you inject ozone gas, and that actually just hyperoxygenates the tissues to stimulate healing. I usually do the PRP because I think it gives me a little bit better results. And what you're doing is using your own juice to speed healing. Okay. Other applications that we'll do for it are things like hair rejuvenation. So people who are starting to lose their hair, like your hairline's going back a little bit, we inject it into the scalp, and it does the same thing for the hair follicles. This is actually also very well, and all these things, by the way, I'm talking about, they're quite well researched. There's publications on the effectiveness of this. We can actually help people like stop losing hair, and even make hair you have look become thicker and fall out less. It won't necessarily advance a hairline, so it's not like a hair transplant where if like you've got a total bald spot, your hair is not going to come back, but the hair that you have becomes thicker, and it will stick nicer, and it'll fill in, and it slows hair loss down significantly. We also do it on the face, facial rejuvenation. It'll help reduce fine lines and wrinkles. We do it either with microneedling or with direct injection. And the other one is for erectile dysfunction, for ED. You basically do a little anesthesia into the dorsal nerve of the penis, and then inject it right into the corpora cavernosa, which is the spongy part of the shaft of the penis. And it helps with erectile function. We also use it around the female perineum as well, like helping with, healing from like episiotomy scars. I've helped with that. Like it's really good to help with scar healing as well. Vaginal rejuvenation actually too as well, because it basically what it does is it takes the tissues that you have and it makes your tissues healthier. So wherever you need to make your tissues healthier, you can inject PRP, and it helps to rejuvenate them and make them work better.
Wasting my time.
You just can't help yourself, can you?